years ago, at the age of 33, Monroe resident Andy Trahan received the news that would change his life forever.
Kept thinking I was going to wake up from a dream.
When this happened 2 years ago, I didn't know what our future would be like.
Stage 4 lung cancer. But another detail about that diagnosis led Andy to think it had to be a mistake.
How can I have lung cancer? I'm only 33 years old, and I don't smoke.
As this new journey in Andy's life began, he and his family learned more about the disease.
If you have lungs, you're at risk for lung cancer.
Doctors have said that lung cancer has become somewhat of a silent epidemic. Lung cancer kills more men and women than colon cancer, breast cancer, and pancreatic cancer combined. But if you line up the top 5 cancers, lung cancer receives the least funding.
Lung cancer kills the most and gets the least.
That's something Andy and his family are trying to change. Andy has a rare type of lung cancer mutation called ALK. It happens in only 5% of patients. Dr. Ross Camage of University of Colorado in Denver has been involved in developing treatments for this mutation.
It's a gene which is involved in the development of us when we're a tiny little baby, and then it gets turned off as adults.
Andy's local oncologist, Dr. Sanjay Joseph, says there has been progress in research.
There's probably been more drugs approved in lung cancer in the last 5 or 6 years than there were for decades before that.
But the special drugs can come at a cost.
Without insurance, it's roughly $13,000 a month.
There's a lot that we are still learning about lung cancer.
But what about those like Andy, who never smoked? Doctors say some causes could be secondhand smoke, radon exposure, or just the environment. That's why Andy and his family are working to break the stigma that lung cancer is just a smoker's disease.
I didn't know any better. At my diagnosis, I thought you had to smoke to get lung cancer.
There's been this ferocious battle fought against smoking, as if that's the only thing we had to do to take care of lung cancer. And unfortunately, we have kind of forgotten to address the disease.
Dr. Camage says despite the stigmas, there have been more breakthroughs in lung cancer research in the past 10 years, with just a fraction of the funding other cancers get.
Look, if we want to put dollars where deaths are occurring, we would heavily invest in lung cancer because you can save more lives than anything else. So just imagine what we could achieve if we actually resource this to the same level as other cancers.
Andy has stayed busy spreading his message. He's helped develop a lung cancer awareness license plate for the state. He's also attended patient forums around the country.
All kind of bonded together. We're in the club that we never wanted to be in.
His own family stays busy too, each taking on roles in Andy's fight.
I think it's the old "it takes a village" concept.
His wife Leslie has been invited to address the Survivors Summit in Washington, D.C. this April. She'll join others to lobby on Capitol Hill for more lung cancer funding.
They say this will either tear you apart or bring you closer, and it has definitely brought us closer with each other.
Andy's daughter is even making bracelets for lung cancer awareness.
She's raised about $265 from people in Georgia and Shreveport and Monroe, just different. It's really been touching.
Leslie says it's also the community and their church that has kept them going strong.
We were at a restaurant the other night. I put it on Facebook. A phone call came in. Someone paid for our meal.
And it's Andy himself who Leslie says keeps the family moving forward together.
He works so hard every day. He pushes through when he doesn't feel well. I couldn't ask for a better husband or father for my children.
I'm not letting it get me down. I'm one day at a time, but I'm also not going to stop living.
Alana Quillen, KTVE 10 News.